We're now on the home stretch. This is our final module of the NDIS Foundations training. We're looking at best practice discharge planning with NDIS participants. This section brings together some of the elements we've described and discussed earlier and brings it together for best practice discharge. And when we note discharge, we don't just mean discharge from an inpatient setting. Let's consider how this works for community-based patients and staff working in the community. You as health clinicians have expertise in discharge planning, certainly had that expertise before the introduction of the NDIS, and will continue to have that expertise. But we do need to think about what discharge looks like within this NDIS context. If we think about the principles for effective discharge from a service delivery perspective, here are some of the principles you should be considering. NDIS education. If the process is confusing for us, you can be sure it's confusing for our patients. Providing good education about the NDIS and the NDIS process is important. Early discharge planning. Don't wait until a person has been on your ward or involved in your community program for 6 weeks before you start the access process. Now that you know what the legislation requires, start the NDIS pathway and discussions about discharge planning early and follow your NDIS processes. Early collaboration, making sure all the key stakeholders are involved in discharge planning. In the world of NDIS, this means working with a person's support coordinator, training support workers, liaising with the NDIS funded OT who will be taking over the patient's care. It's important to do early exploration of housing and support options. Start having discussions with the patient around what their housing goal is and what their housing preferences are. We have lots of evidence that when a team takes this information, a person's housing goals and their housing preferences, to a planning meeting, then the outcomes are more positive. Make sure your key NDIS supports are in place. Make sure all the person services are set up and ready to go and you've done a thorough handover. There are also operational principles and processes that can assure effective discharge outcomes for NDIS participants. What does your service currently have in place to support you to do good discharge planning for NDIS participants? What education related to NDIS is in place for staff? Is everyone on board and willing to contribute to NDIS related work? Is there a whole of hospital approach to NDIS, from acute to subacute to community? Does everyone know their role and know where to find local processes and information that relates to the NDIS process? Do you have KPIs around timeframes to get your reports together? Who is reading the final reports and doing quality assurance to ensure that the reports are writing in the NDIS language? If you're experiencing any delays or barriers, are you clear on when and how to escalate these so they can be resolved? Are your pathways for escalation clearly defined? Is NDIS embedded into your handover process? If someone moves from subacute to community, how does the community team know what part of the NDIS process was the participant engaged with? The current COVID-19 situation has resulted in significant impact on hospital discharge. Due to the risk to NDIS participants in hospital, there has been more of a need for early discharge. And you could say a push for discharge for these participants. Hospitals are also setting up for a more acute delivery of services. So what can we do? What actions do we need to take in this current situation? It's important to start early, start the access process as early as you can, escalate for access, provide evidence for access, urgent access letters, early identification of change of circumstances. If there is a need for change of circumstances, be aware of the escalation process. If funds are exhausted due to COVID-19, for example, a day program is closed and the day support funding won't cover the time spent at home while the program is closed, a participant will need more core supports. They can request an escalation for more funding if their funds are now exhausted due to COVID-19. In this case, a participant or their support team can request a light touch review. This is called a COVID-19 escalation. Consent does not need to be from the participant or their representative. For COVID-19 related needs, a provider can trigger a request for consideration. This request for consideration is different to standard practice in terms of who can trigger a review. In supporting someone for an earlier, quicker discharge, it's important to consult with key stakeholders. Know who can help you. Your health liaison officer, your NDIS team lead. Also consider community service referrals. What supports can a person have in the community now that they are having an earlier discharge? Of utmost importance is having a robust NDIS plan. And this does include escalating a planning meeting so that the critical information that's required for funding support, such as a person's goals, their long-term housing needs and preference, their support needs, their needs for AT, are communicated before the planning meeting. The use of an interim plan is really important here in this situation, ensuring that the recommendations you have in an interim plan include support coordination hours, extensive hours for assistance for daily life, health-related disability supports, PPE. Make sure it includes those funds for interim housing, medium-term accommodation. It's important that us as health clinicians attend that escalated planning or plan review. We're providing updates on the NDIS COVID-19 response in our community of practice. This brings us to the end of part 1 of Safe Discharge Planning for NDIS participants. Our final section of the NDIS Foundation training, we'll be speaking about collaborative discharge planning. This section brings together some of the elements we've discussed earlier and describes how they come together for best practice discharge. And again, when we discuss discharge, we don't just mean discharge from an inpatient setting. Let's consider how this works for community-based patients and staff too. Discharge planning for NDIS participants is complex. At the Summer Foundation, we've worked on multiple projects with health services across Victoria and New South Wales, which focus on how support coordinators can work most effectively with health in the discharge process. And this wheel you see is a result of that work. It breaks down discharge planning for NDIS participants into 5 main activities. Each activity in this wheel has tangible actions that are shared by support coordinators and health. The activities where collaboration between health and a support coordinator is most critical is from activity 2 to activity 4, where housing and support options are being addressed. The Collaborative Discharge Planning poster is a resource which outlines those tangible actions shared between health and support coordinators within each of the main activities of discharge planning. It's available online on our Summer Foundation website, and many of the actions include links to resources that will guide you on how to do things, such as writing a cover letter for urgent access or writing a pre-plan. This can be useful in your conversations with support coordinators when working out who is doing what to support the person with a disability to leave hospital. When you're working with a support coordinator, there are some key points from a list of actions between health and support coordinators. These are some of the things you would be talking to the support coordinator about. Collaborating as early as possible around the critical supports that are priority for discharge. Collaborating as early as possible on the need for housing and looking at whether there wouldn't be a need for an interim option, such as medium-term accommodation. Will there be a need to test for eligibility for specialist disability accommodation, SDA? Or are we looking at more of a mainstream non-SDA housing options? A program that both health and support coordinators need to be aware of is the Exceptionally Complex Support Needs Program. And as you can tell by the name, the eligibility really relates to NDIS participants who have met access and have highly complex needs. The definition of complexity relates to people with multiple disability needs, those falling through the gaps and have involvement with multiple mainstream services, and there is a crisis situation, e.g. a breakdown in caring situation, or primary carer becomes unwell. There is an after-hours support line, which mainstream services such as hospitals and police have access to. When working with a support coordinator around discharge options and exploring housing options, it's really important to be aware of the Housing Hub website. It's a place to go search for property with accessible features. On the Housing Hub, you can find homes to rent, buy or share. You can put in the location where you want to live, and a list of properties will come up along with features, pictures and information on the support provider. The website has been upgraded now, and there'll be lots of new features coming soon, so keep checking back on the Housing Hub. To finish off this work, let's work through a case study and look at what discharge would look like for Stephen when working with a support coordinator. This is a case study that you were aware of before. So let's ask the question, what does this type of collaboration between health and support coordinators would look like for a person like Stephen in hospital? Using the collaborative discharge planning activities, we can identify which tasks are the responsibility of health. For example, this includes completing functional capacity assessments for Stephen's AT needs and potential discharge options. It's important to realise that functional capacity assessments is more of an NDIS term, and it really refers to any assessments that you normally do as health clinicians around facilitation of discharge. And they are the assessments that help you determine what the person needs, their supports, their support levels, their AT need, and being able to communicate their housing needs and preferences. So it's health's responsibility to use a pre-planning tool to provide evidence that will get an early interim plan that includes funding for the key supports such as support coordination hours, medium-term accommodation, specialist assessment hours, for example, the assessment hours for an occupational therapist, to complete assessments to test for eligibility for SDA. Also included in the interim plan is recommended social and community access and disability-related health supports. And once the plan is approved, we can use the collaborative discharge wheel to think about what activities will health and support coordinator need to do together. Firstly, health and the support coordinator will need to collaborate to arrange NDIS providers. For example, there may be an NDIS-funded occupational therapist to do assessments in regard to housing, assessment in regard to home modifications. An occupational therapy assessment may also be needed to support an application for SDA. The support coordinator would then use the information from health as well as the information from the private OT to put together a housing plan for Stephen. Health and the support coordinator would also be collaborating together to arrange carer training and making sure support workers are well set up and ready to go when discharge occurs. We've learned from other health services that there are certain things that can improve working with support coordinators for health. These include really being clear on your roles and responsibility, who is doing what and by when. And this is roles and responsibilities on both sides, being clear on what health's responsibilities are and then asking the support coordinator to bring forth their roles and responsibilities. It's important to start these conversations early. Set the timeframes, set the expectations. Consider a referral form to enable health to easily provide support coordinators with the information they need to do their job. If you come across good support coordinators, get their brochures, get their information so you can support your patients to make an informed decision when choosing a support coordinator. Remembering that choice and control always stays with the participant. The other thing that works well when you're collaborating with support coordinators is having a policy that enables NDIS providers to come on site and deliver a service. Consider having written agreements so that all stakeholders are clear on roles and responsibilities and timeframes. Establish how you will communicate regularly. Phone calls, emails, how often? If your service has a clinical practice guideline, it's also helpful to include information about collaboration with a support coordinator within this and defining what this could look like. So let's recap on today's session. The first step is to apply for NDIS as early as possible via verbal access request. Use supporting evidence template with functional language and a cover letter outlining the urgency for access. Once a person has met access, the next step is to advocate for NDIS plan with appropriate supports. And you can do that via your pre-planning template with functional language, supports linked to participants' goals, supports justified through reasonable and necessary criteria. Lastly, collaborate with support coordinators as early as possible. This may mean that you're collaborating early around the pre-planning work, or you could be collaborating around the implementation of the plan. You're working early with a support coordinator around identifying housing needs and preferences and exploration of housing options, what's needed for interim housing, and you're collaborating together around arranging supports. The practice team at the Summer Foundation have a community of practice. We encourage you to join. It's an opportunity to share updates, news and resources. We want to share expertise that is out there. We want to identify best practice for working with younger people with disability and complex support needs within the reform of the NDIS and what's best practice for discharge. Here's details around how to join our community of practice.